The world has got to change. I lived in a community that was so prosperous with doctors and lawyers and politicians. Now we have drug dealers and corner stores that they don't sell anything but the wrong things. You cannot deny the impact that it has on people's health. I had been in West Baltimore my entire life. As far as money, my mother didn't have any money. I don't want to say she was poor, I'll say low income. Poor we were though. In the 50s, we didn't have many choices as far as healthcare. The healthcare system then was limited. It was not good for us. And medicine costing so much that my family says sometimes, will I eat or will I pay for my medicine? Which one do you want? Oh, I just love my daughters when they come over and we get together and we cook and prepare meals together. It's healthy meals. When my oldest went to college, she came back with a different diet. Now what happens is if I do a meatloaf, it's turkey instead of ground beef. I make spaghetti, I make chili, stuff like that. It's with turkey and chicken. We grew up, we ate pork. We ate bacon, we ate a fresh shoulder, we ate pork chops. I did not think it was not healthy eating, right? Because this is what we were accustomed to. I was in denial. I didn't want to face the fact that I was becoming a diabetic. The impact is the fact that my family ended up with heart disease, emphysema, diabetes, cancer. My mother's sister, her daughter died of diabetes. She was an amputee. My mother died of a massive heart attack. And
to address health disparities, we need to understand why they exist, that they're not due to one single factor. They're the result of policy decisions we make as a society. They're due to the environment, health education, insurance and access to care, access to healthy food, and stress. Those stresses are actually experienced disproportionately by people who are poor and people who have been historically disadvantaged in this society.
solutions to these problems cannot just be medical, it's systemic. And that means everybody has to get involved.
If we want the nation to be strong, the people in that nation have to be healthy. They have to be well. If there's anything that we can do to stamp out disparities, we need to do it by any means necessary.
Hi, Ms. Simmons.
Here at East Baltimore Medical Center, most of the patients are underserved.
Do we need nice deep breaths in and out through your mouth?
Michelle is a terrific success story. There was actually a year where she had lost her job, and before she found a new one, she had no health insurance. And she still managed to buy her medicines out of pocket, paid out of pocket to come and have doctor visits. She was really invested in her own health. That's something that Dr. Cooper's research is looking at, why patients don't invest in their health like we wish they would.
The next thing on the agenda is the community update. So I'm going to turn.
Michelle joined our community advisory board in 2011. We provide education to the community about health and about research. We offer training programs for community health workers. We can be sure that we are meeting the needs of people appropriately and that we're not leaving out certain groups of people that have traditionally not been included in conversations related to health and healthcare. Our strong relationship with the community is just essential. There's no way that we could do what we're doing without their input. And my work is just one of many initiatives here at Hopkins.
Good to see you too.
Ms. Simmons is a great example of what happens when we get it right as clinicians and as an institution.
Shalom, shalom, my people. Thank you for tuning in to the Black and Healthy Restoring Black America channel here on YouTube and also broadcasting on my Country Living in the City page on Facebook. I am your host, Jawanda Smith, RN Case Manager and Community Advocate. I hope you enjoyed that short video from John Hopkins about healthcare disparities around the community and what they are doing to try to help combat the problem. And I think it's a great idea that the clinicians are getting together with patients in the community to find out what is needed in the community. But I'm going to give you another insight. Well, while doing some research, I found an article from the National Institute of Health with the National Library of Medicine that gives some insight to the United States about how other countries see our healthcare system. Let's take a look. Alrighty, guys. This is the article I was talking about, National Library of Medicine, National Institute of Health, and it states comparing health systems in four countries, lessons for the United States. In other words, they're telling the United States they don't know what they're doing. But it says the rekindling reform uh, initiative examined the health systems of four countries: Canada, France, Germany, and Great Britain, United Kingdom. For the four country reports published in this issue of the American Journal of Public Health, 10 cross cutting theme themes emerged: coverage, funding, cost, providers, integration, markets, analysis, supply, satisfaction, and leaderships. Lessons for the United States are presented under each point. Isn't that absolutely crazy that they are pointing out in this on coverage, funding, on all those points? They are bringing to the United States to let them know what other countries think about this. So they talk about universal health care. They talk about how um, they create the margins to make sure that everyone in the country has health care. Now, even though we had Obamacare here, did it make it to 90% of or 99% of the people in the country having health care? No, because there's always a capitalistic um, underlining in anything healthcare here. If somebody is not making billions of dollars, it's not good for here in the United States. And it's absolutely crazy that people continue to allow the United States to do that. But I will post the link to this article so you guys, this research study is actually a research study, I believe, because they break it down into a study. Well, and it talks about so much, and it's easy to read. It doesn't have a lot of technical technical verbiage in it that you wouldn't understand. So it's easy to read. So, well, guys, that's all I have for you today. I do encourage our healthcare professionals, our clinicians, to take some initiative to help out these healthcare disparities, even like John Hopkins Institute is doing, where they're going into the community and forming panels so they can meet the needs of the community. That makes a lot of sense, since the United States continue to make money off of people's health, we might as well try to combat that by making our people as healthy as possible. So that's all I have for you. I will post the links to the videos I have, the information to the article, and also I'm going to post a link where you can help support John Hopkins or possibly start a community group with patients in your area. So take care of you, take care of yourself and each other. Until next time, shalom.